official that we have a podcast.
That's our
Not that-
green screen.
but it's not like that we have like a huge following or anything. So it's like like we make it seem more fancy with this than we probably are. But what I was gonna say is that like I do the same thing. Like I have so much stuff in my head, and I think I'm worse at it right now, where I get kind of stuttering on this because the longer you do something, the more information you got in your head about the subjects, whatever your expert wellness or what have you. And then I just, like, you're trying to process it through so fast and get it out. So I kind of come off like I'm all over the place.
Right.
But I say it's because I'm such an expert.
There you go. That is perfect.
Yeah.
But I think that I had never thought about that from that perspective before. That it could be because I have so much knowledge and so much experience. I feel like I do talk fast. So when talking fast, I think that I'm just trying to make my mouth keep up with my brain.
How many years have you been?
I've been in the
I guess,
healthcare professional probably about 40 years.
So okay. You got 40 years of stuff, like serious stuff in your head. It's going to be tough to try and get it out the right way.
Yeah.
I mean, I should probably make more of an effort to do it better, but
yeah,
I think also it's a product of age. Like I don't know how much I'm going to change at this stage. I'm an old dog, so
you and me both.
I mean, they always say people say like, oh, you should always strive to get better in your life as you get older, which I get the sentiment of that.
But if it's working, it works.
Yeah,
that's the thing.
Like, it just sounds like again, like I'm being resistant to change. But it's like, do I really need to?
Yeah.
Because some people say like, work on your weaknesses. Like try and like shore up. I say, forget your weaknesses and focus on your strengths.
I love that.
Isn't that why you have like a loved one or you have people in your life
that balance you out?
Right.
They balance you out, definitely.
Yeah.
Yes. Yeah.
So I got a chance to meet your husband just for a second there, and the kids. They seem great, but he's got so much stuff going on. I didn't really get a chance to talk to him.
Right.
Did you tell him about Bella's crib?
I did tell him about Bella's crib, and we talked about. We've looked at like Class B and Class C.
Yeah.
And been looking at. See, I go again. Different things about the RV life, and he was supposed to come over, but we just got so busy, and I was going to come over with him, and
But then again, it's like there's so much content out there of people who actually know what they're talking about with these things. I would never rely on me, that's for sure.
Well, no, but I just like the fact that these come in and get a feel and see if it's too cramped or not, and this is nice right here. Now, I know you wanted something bigger, but I don't know if we'll ever do the fifth wheel.
Right. Right. I mean, so Alex, the guy that was outside that you met, so his in-laws had a fifth wheel, and they actually went down from a fifth wheel to a Class A, which is all self-contained, like the Winnebagos, that's like kind of flat face. So I was like, well, that's interesting. I've always heard just the opposite of people's, like they can start out smaller and then they end up migrating to a
bigger
fifth wheel. So there are those people out there that are the fifth wheel is not the right call for them.
Right fit for them. And again, like we talked, it's the steering. You have to train your brain to think backwards when you're trying to back up.
Yeah.
It's like the opposite of what you've been doing all your life. Yeah.
Yeah. And I'm like, I don't know if I mentioned this to you before, but I was thinking with this one that I wanted to get like a little like Chevy Sparks or a Jeep or something that you can flat tow behind.
That would be nice.
So then you park this and you got someplace you got to go, or you want to go and see something that's too much of a pain to park this thing. But then you're in the same ballpark. Then you're in the same situation as if you had
the trailer. It's the same thing. It's the same thing. Exactly.
So it doesn't really help out with that.
Some of the other things we've been looking at on the YouTube is like, do we want to just start small with the van life? I think van life would be way too small. For some reason, I have a dog. We'll have our dog with us. Yeah. So I'm like,
big dog or small dog?
He's about 57 pounds. He's a chocolate lab mixed with pit bull.
Okay. So it's big. I used to have a lab, and they're like, they think they're lap dogs. And they're, 80 pounds, whatever it is, 50, 80 pounds.
Right.
It's like, no, that's not. Of course, you don't want to say no to the dog, but they think, yeah.
I'm in my 11th year. So January started my 11th year with them.
Okay.
Yes.
All right.
And I've grown in that role. Initially, I started off as a benefit analyst.
Yeah.
Then I went to the manager of insurance and benefits, and now I'm the director of insurance.
And then you told me you're also doing other types of insurance.
So insurance, so the three areas that's under my umbrella is insurance and benefits, which would be property and casualty,
Yeah.
health and welfare, and then wellness.
Wow. And so when you do an event like this, you're thinking about all the insurance, the property, like where are people parking, where is everything.
Yeah, like even parking the van here, to make sure that we have the right proper space, that we don't have anyone coming up on the side, side swiping it.
Yeah.
We have enough distance between that,
yes,
that type of thing. And then also parking. So when we start on the insurance part of it, we're looking at do workers' compensation. It's under my umbrella. We also have our buses, all our buses, our buildings, all our equipment.
What else can they throw on your plate?
So insurance is everything. It's the whole umbrella. And the health and welfare side, medical, dental, vision, life, all the supplemental plans and things like that. Yeah.
Yeah. And I didn't get any video of the event. I wish I had.
I may have a picture I can share with you.
Thank you. Thank you. Because
I can do that.
I mean, honest, I've been to a few of these over the 25 years that I've been doing it. Both domestically and internationally, and you put on a good show.
Thank you. I appreciate that.
Good show.
Doing wellness probably 20, 30 years.
Well, you're ahead of the curve, because I'm not sure most people knew what wellness was 20 years ago.
No.
Yeah.
It was like real small things, like let's do this. Someone's really stressing. Let's get an EAPs. EAPs help a lot.
Yeah.
Employee assistance programs. Yeah. Filtering issues and that with them, it helps a lot. But then also they give you a lot of feedback, and they can come on site and do seminars and webinars and things like that. So most companies 20 or 30 years ago still had EAPs, employee assistance programs, but they kind of evolved a little bit different into wellness, nutrition, financial well-being, and things like that.
Well, I'm really, I applaud what you're saying here, because I've been kind of around it, but not obviously in a role like yours. And for me, I never knew where the lines drew, but it did seem like there was that transition from EAP more and more as wellness became the kind of more umbrella.
Yes.
Over. Okay.
Because the EAP, before was thinking more like just counseling.
Yeah.
That they do meal prep.
Yeah.
They do financial well-being, elder care assistance. They go into a whole umbrella of things to help the employee in all aspects of their lives. Sandwich generation, or wherever you're at. Yeah.
Well, it's funny you said about the elder care thing. I think that's got to be a big thing, right?
With the baby boomers, there's a lot of us.
Yeah. Yeah. I mean, it's. I think there's just so many. I guess I don't know. How do you feel like in this big role that you have with various things, we're talking on the wellness side, do you feel like you often go to your teammates or your employees to get their feedback first and be reactive to them, or do you think it's more of a you find vendors
as far as wellness and that? So most of the vendors we have are our contracted vendors, our medical, dental, vision providers, but then we also have supplemental plans as well.
Yeah.
Like I showed you, pet care. We have 2 pet cares. We have, so we that's really big, especially for people who are kind of more like the empty nesters.
Yeah.
They have pets, and then even during COVID, a lot of people got pets. So
therapy. Therapy,
exactly. So, and they kept those pets. Hopefully, they did, and that was a big thing. We rolled that out about 2 years ago for pet insurance.
Yeah,
and people like I love my pet insurance.
Yeah. It's funny because I'm talking to people in the industry. It's like if you look at these now, that especially also young people are not maybe as eager to have kids earlier on in and they do think if I had to choose what insurances I would want. Of course, everybody would take everything that they can.
Right.
But, if they had to prioritize it, I had heard from other people that even the pet insurance was maybe higher than other types of insurance that are more traditional.
Right. So, because some of the traditional, voluntary life insurance or voluntary plans, I would say the Aflac plans, kind of other carriers have that. But if you want additional coverage for critical illness or for a hospital indemnity or something like that, if they have a pet, they can do the pet first.
Right.
Because they already have the minimum, the basic coverage through the medical. This is additional, will pay that individual a benefit directly.
Do you feel is that one of the hottest new things? You said you had it for a couple of years, but I'm going to
tell you the really hot thing that we just did also about 2 years ago. We have a nearsight clinic, which we partner with 3 other districts.
Okay.
So our employees, they only see our employees.
Okay.
So they have 4 clinics.
Oh, good.
Yeah, and our employees they go there. They have the no copay from the PPO plan.
Yeah.
They have free generic drugs, and they do blood testing.
Wow.
And that individual can become your primary care if you don't have one.
Yeah. Well, I mean,
Yeah.
And family members can go as well.
Pardon me?
Family. So members.
Yeah, as long as they're enrolled in the medical plan.
Yep. Okay. Mm-hmm. And you said you're using. You say.
What the name of the?
Well, the insurance, the carrier.
Right now so it's Carry CT.
Okay.
Yeah.
Okay.
So those are the on-site clearing. They have those throughout the United States.
Yeah. Okay.
Yeah.
Okay.
So if you ever look into it, they're throughout the United States. It's not just something that we have here. Let's just go.
I'm familiar with like Premise Health and Marathon, but this is called Care AC.
Care ATC.
Like I don't know if it's like I'm thinking like an airport code.
Just about it one time, and they had changed it. So we had posted it one way. They said, "Oh no, it changed a couple of weeks ago, and we're naming it this, but it's the same
acronym."
Yeah.
Okay.
Different words for it.
Okay.
So yeah.
Okay. Very good. Okay. And well, that I guess, given that it's a spread out area that you're talking with all the counties that you go to, yeah, that makes sense. You have to have 4 different ones just to get people in, but.
Yeah.
I mean, you feel like you get good utilization.
We've been getting great utilization,
really?
and everyone who goes, we've never heard a complaint about it.
Yeah, and you're giving them great incentives, right? So it's drawing it to that, and then you get more data, and you get more ways to improve upon it.
Improve upon it, yeah, and they actually work with our medical provider as well.
Yeah.
So if for some reason that individual just needs to be seen, what's good about the Care CT? I left that totally out. They have same day and next day appointments.
Oh, nice.
What if somebody having like cold, red eye, pink eye, or whatever the case may be, they can go in and be seen by someone.
Yeah, get them in.
And if you don't want to use them as your primary care physician, you do not. They'll share that information with your doctor.
Nice.
As long as you sign a release, they have a release. Yeah.
Right. No, that's brilliant. That's brilliant. Well, that's good. So that's a hot thing. So would you consider that on the wellness side as well, or would you consider these near site clinics?
I look at it kind of on the wellness side, because those individuals who don't have anyone and they need to see someone right then, and then those doctors know our benefit plans. They don't just know the medical, dental. They know about our EAP. They know about this whatever plan we have. They know about, and they can refer them and say, "Well, did you try this? Or did you know you have this wellness program through Wellbeats or do Wonder? Just for relaxation and stuff." So they actually promote our plans that we have.
And did you? Because I love that. I mean, I think that's the biggest thing. Is there's some a recent book, and now of course I'm trying to blank on it, but that I listened to that talks about this. Is that our whole system of medicine in the United States would really steers people to one specialty. So if you're going to be ear, nose, and throat, or you're going to be cardiac or whatever, but it's about getting that connected care. But I think that's
all need to talk.
Yeah.
Everyone needs to talk to each other. If you've been treated from one thing here and another here, and what medication you're taking on the initial thing may impact what your second condition. So you do need everyone to talk. Or at least have one primary care person that's going to facilitate that specialist.
Yeah, and as the organization or the school or the employer, making sure that these different organizations communicate and know about each other. I mean, I think that's a great thing. It sounds like that this organization you worked with, they're really they kind of took the bull by the horns on that.
Yeah, and I think there's other organizations that have near-site clinics, and that is another name of them. What we really like is the fact that the patient, our staff member, can go see them, and then they can say, "Okay, do you want to use us as a primary?"
Yeah.
And like, "No, I just want to keep my own primary." But they can say, "Well, here's your primary, but did you know, since you think you have this issue with relaxation, that we have a Wellbeats plan that has mindfulness, and that your employer offers free to you.
Yeah.
And all you have to do is log in and do some mindfulness things. Or if you're nutrition, you're concerned about your weight, there's nutrition out there. Our EAP has nutrition. We have a Wonder program was for weight loss, and then we also have Wellbeats nutrition. So we have fitness classes, so it's available to employees.
I mean, I think I was telling you, we do this internationally with a client Workday, where we really try and integrate with their other services, even if they're not something we do. But we need to make sure that we know about it so that we can make sure that we pass that on, that patient and on to the right care provider. But I mean, it's also I think we were talking about yesterday is, obviously mental health becoming a more and more important thing. There's a little height, like almost height, like hygiene stuff that you can do, whether it be about your sleep or your nutrition. So it may be mental health related, but you still got to take care of, like, are you talking to your loved one enough? Are you going on a little, not a long walk, but a walk with, your dog or something, getting that oxygen in your system and getting
releasing tension and stress. Yes.
So it can be really important to make sure that you're not jumping over into something that could be more of a significant complex solution, but really trying to get to the little stuff first and take care of that. But so for this event, how many different, I mean, just off the top of your head, how many different vendors did you end up having to put together?
So we probably had about 40 to 50 vendors.
By going through it, it looked like that.
Yeah. I'm just thinking about tables. It probably was more than that. Yeah. Yes, and we start out. We work with our medical provider because we do have a wellness coordinator, and that helps us on the wellness side. I mean, on the medical side. But it's basically all the vendors that we utilize, and then we bring in other ones. Like we have this individual who does essential oils.
Okay.
Yeah, which is for relaxation and wellness. We also had our event is family friendly. So we had the kid photo booth, we had the balloons, we had face painting, characters. Yeah. And I always say the biggest kids are our adults, and because we want one too, it's not just the children's. And so it does work well, and it's always a great event this time of year because it's right before school starts. And when I like the buzz in the room, I'm all about buzz for some reason. And when they see people and they hadn't seen all summer, I haven't seen you so long, school starts back in 2 weeks, so this camaraderie.
That means a lot.
Yeah.
That means a lot, especially as a lot of people working from home and after the pandemic. Those connections mean a lot to people.
Yeah.
I mean, it's funny. When I was in Dubai, the World Expo was going on, and this is when they had these booths of like massive booths for all different countries. And the Emirates Health System asked me to be on a panel about mental health, and I'm not an expert, but I've been a little bit on the periphery of it, and started talking with some people from like WTW, Willis Towers Watson, various people from the insurance industry, and just kind of getting some information before doing the panel that I was on. And one of the things that I had that I'd seen on the research that I think came through WTW is that the younger demographic was far more comfortable talking to like an AI, like a AI chat GPT type thing than they would be comfortable talking to an actual person on their mental health. So of course I'm old as dirt. So like I'm thinking like, wow, that's so weird. Like I would rather talk to a person.
Right.
But you gotta be. I mean,
you got to be open and flexible. Yeah, because a lot of the things that came out too out of the pandemic is virtual care. Because we always had nurse line, and you can do virtual if you have to go into the doctor's office and you just tell them what your condition was or that. Yeah. But it was different during the pandemic because doctors were actually doing virtual. The EAP did virtual. Yeah. Counseling did virtual medical, and then the virtual with the exercising and stuff we were talking about earlier. I mean, everything went virtual. So I think people are getting more and more comfortable with it. The generationally is different.
Like I start thinking about it. So I would say I'm Gen X. You said
I'm Boomer.
You're Boomer. Okay. Mm-hmm. But I mean, you remember that, I don't know, like remember being on having taken a phone call at your house, I don't know, it's somebody that you're interested in high school, and they call the phone, and dad or mama
answer the other line. Yeah. You didn't have these. No, it was nothing personal. It was like, and I'm going back, the wired cord, pink and color phones. That's what you're talking about, right? Yeah.
Yeah. I mean, I like
the rotary dial.
Yeah, I remember all but there, and then, like the other thing is, like I think I told you, I lived in Denmark for a bit, and I'm of the generation is like if you meet somebody, you go and say hello, you have a conversation with them. And as an American in Denmark, Americans obviously we're known to talk a bit,
a tad bit.
But when I moved there, it was like there was two things that I thought were funny. Is that number one, I lived in an apartment building that had like 5 floors or whatever, and there's a stairwell. There's no elevator. So I'm on the first floor, which is, in the U.S., the first floor is the ground floor. At least that's how I think of it. And the first floor there is like one floor up. And I just remember it's like my neighbors, like no one would really talk in Denmark. No one would really talk to each other if you're in the hallway, like going up and down the stairs, which is like, we don't know Americans, we don't know what to do with silence.
Right.
We're like, no, you have to talk, you have to say something. But
it makes us suspicious.
Like,
what's going on?
But that was one thing. It was like, and I would ask people, I was like, no, they live in my building, but like that doesn't mean that we know each other.
Right.
So it's just a different cultural difference.
But would it have been only 5 stories though? That seems less different. But I understand those huge complexes that people may live in. You may not. You just cross them in the elevator, but you still say hi. Hello.
Maybe it was just me. I don't know. But I noticed it was it was more like crickets. Probably. And it's so. And also here's another thing that I found interesting is like there would only be. It's either 2 or 3 apartments per floor, and they call it an opgang. I'm sure my Danish friends that are listening to this are probably like, he was always terrible at Danish. But so it was like opgang was like the stairwell, and when you on each floor, I think there was either 2 or 3 apartments. That's it. Mm-hmm. But then the name of the apartment wouldn't be like 1D or 1F or 1C, something like this. It would be first floor to the left, first floor to the right. So the name wasn't associated with like 1D. It would be like you're just saying, you got to know your lefts and rights.
And which way you're facing.
Yeah, exactly.
Exactly. And what, your left or my left?
Hallelujah. So I was like, that was more like, I was like, that's to the left, to the right. Now I should say ended up being one of my best friends. That's what I was saying. So Danish guy, he was living on the 4th floor. And I remember I don't know if it was the beginning of winter or the end of winter, but he was trying to carry up his winter tires or the spring tires of his car up the stairwell. And I said to him, I was like, do you want some help with it? And he was like he didn't understand why I was offering the help or who would
neighborly.
do this? Yeah, but it was something like quite unique from this. We've known each other for 20 years now, so we became good friends from this. But that's how I met him. This is like trying to help him up. Which also I thought was interesting is that maybe this is something in St. Louis, but you're from Chicago. Mm-hmm. I'm from Indiana. I don't ever remember having spring or winter tires.
Oh, no.
No,
we did not have spring and winter tires. We just used the same tires. That was it. And it was icy at some point, and you're inclined, you put chains on your wheels.
Yeah, okay, there you
that
go.
was it. Yeah. I don't remember spring and winter tires either. No.
Maybe it was a special car for some reason. I thought this was interesting. Can you imagine?
They all weather tires.
Yeah, all weather tires. You have one set of tires for all year round. Anyway, so I don't know how I got on that topic.
That's okay.
So you did this 40, 50 vendors. You organized all this. You're thinking about the insurance from the workers' comp to people walking in the walkways and everything. I mean, to do something for, as you said, nearly 40 years. It's a passion of yours. You have to be passionate about to do it 8 hours a day, 5 days a week. For 40 years. And
I've always say that benefits is ever changing. That's what I do like about it. I mean, I've been around dating myself a little bit, but I wrote COBRA law when COBRA first rolled out in 1986.
Yeah,
I actually wrote the policy for my company.
Wow.
Yeah. So and then ACA came out, and I did a lot of that. So ever changing is what keeps me passionate about it because I do like the fact I do care for individuals and health and that, but I like the fact that it keeps me interested.
Yeah.
Because I'm not a person that could do the same thing every day, all day. Yeah, and everyone, employees and that have different issues and stuff and conditions that they need to help work them through.
Yeah.
So that's why I really like the realm of benefits, but even wellness even more so because wellness you're trying to get them before they get to that condition.
Hallelujah. So there's I'd probably say this book too much, but I feel like it has become the backbone of access care. But there's this book called Longevity. I could be saying, I'll send it. But this guy, Peter Attia, he went to Stanford. He was going to become a doctor, and I think he did become a doctor. But then soon, right after that, he went over to more of the analytics of medicine, and he talks about the medicine 3.0, which is like what he calls what we're in right now, which is doing this is so you can have longevity of your life, so that when you're at your retirement, you have all of your teeth. You can enjoy a really good meal. You can you've done the stuff early on in your life so that you can have a good steps, and you can walk and all of this. So it's about being more proactive on your health rather than preventive or reactive.
Yeah, reactive. I think preventive is good because those are your screenings, the mammogram screenings, or your prostate screening. All those screenings are really good, but those are help in indicating so you can catch something early enough.
Yeah.
Like for breast cancer and the cancer has come a long way in how they treat it in that. It's not, cancer was like, oh my God, you got cancer a long time ago, but now you're like, okay, how are we going to move forward?
Yeah.
You can move forward and actually have some type of medications and that can help you through it.
Yeah. Well, I know I've taken up a fair bit of your time on a busy day with 40, 50 different vendors. You get your family here and everything.
Yeah.
I wanted to say thank you for having Access Care out. The Mighty Molar also says thank you for having him out. As well. It was a little bit hot today, but he got through it without passing out on little kids.
I'm thankful he didn't pass out because I would be the one like, work time?
Right.
Wait a minute. I wouldn't necessarily be work time, but liability because you're on our property. And to secure all our property as well. Yeah, insure it. Yeah.
Absolutely.
No, I wouldn't want you to pass out.
Thank you. No, but we had a great time. We're very happy to be here. I've certainly learned a lot from you, and I hope that we can stay in contact.
Definitely. Yeah. We're talked already, so that'll be great for us. Thank you so much for having me. I appreciate it.
Thank you.
And I think everything went well. I love the pod.
Oh,
Let me just tell you that because I have never been in one before, and I took some pictures this morning.
Good.
It is excellent. So I'm interested to hear my feedback from employees.
Good.
Next thing I'm going to try to do is put out a survey.
Yes.
From the people because they did an attendance and then ask them, what did you like, what you didn't like, and I have the individual list of people who actually did the different screenings as well.
Good.
And just get a survey back. I mean, it'd be like 3 or 4 questions. It won't be great, and I can share that back with you.
Please do. We'll take the good, the bad, the ugly. Obviously, there's always room for improvement. And the other thing is like what you talked about your near-site clinics. Is like, we want to help people get on a better, that they would continue to go. Because not just trying to get the people that have maybe taken a couple years before they've gotten their teeth cleaned, but to get them on more of a continuity of care.
Yes.
So if there's anything we can do and to improve, please let us know. And hopefully we'll be able to see you again here sometime.
That would be great. I would love it. I'm interested in the feedback, but just for me, this and how everything's set up, I think is enough privacy.
Yeah.
I think it was just well maintained, and I think employees will have excellent feedback. I'm just waiting to see what they say. Fingers crossed. I think it's going to be really positive, though. They always enjoy the health fair in total. Yeah. And you have maybe one or two people that may say something, but I'll share that with you too, whatever the case may be. But they chose to do it, so I'm assuming, and I'm probably positive that they had a good experience. I'm sure.
Well, I'm
more than like these hoping to be positive.
Yeah, like I said, we'll take it all, whatever it is.
Okay, that sounds good. Okay, right. Sounds good.
Brenda, thank you so much for your time.
Thank you. I appreciate you too.
All right.
Great, thank you. Have a good one. Signing off. I'm on TV.